On this episode, we're going to be talking about coronavirus, the birthday rule here in California, and how to get exceptions on your prescription medications.
Welcome to the Medicare Readiness Show!
Hi, everybody. Welcome to the Medicare Readiness Show, Episode 4. My name is Elliott Martin, and today we're going to be covering a couple different topics from the coronavirus updates, Medicare Supplement plans, and the birthday rule. And we're also going to be covering how to get exceptions made on your prescriptions. Just a little bit about what we've been up to. We just got back from a financial advisors conference in Florida. So my dad, Ray Martin, who's the president of our company, and my brother Mohan, the three of us went out to Florida. We were there from Tuesday through Friday of last week. Definitely different weather out there, lots of humidity. Everybody that came there from the East Coast was saying, oh, this is not humid at all. But we were definitely feeling the humidity there, and it was in the upper 80s as well. But really nice weather. It was beautiful out there. So now we're back. We're getting back into the swing of things. And of course, the one of the biggest topics that's been talked about recently is, of course, the coronavirus and kind of this hysteria with the coronavirus going around. It's definitely a serious issue we're having to face in the world. But, of course, we want to keep things in perspective and, don't panic if we don't need to panic, but be vigilant. And one of the things that Medicare actually just came out with, they came out with an announcement. I think this was from maybe Thursday of last week. And here's their little update on the coronavirus. Here's what they say. You've likely heard of the coronavirus in the news. While there isn't a vaccine yet and the immediate health risk remains low, Medicare is still here to help. Your Part B medical insurance covers a test to see if you have coronavirus. This test is covered when your doctor or healthcare provider orders it. If you get the test on or after February 4th of 2020, the test is covered by Medicare. Usually you pay nothing for Medicare-covered clinical diagnostic laboratory tests. So it looks like because this is considered a preventative service, Medicare will include it at no copayment, no out-of-pocket cost to you. But of course, if you have a Medicare Supplement policy, a lot of our clients have Medicare Supplement policies. If there was out-of-pocket cost, if you have a Plan F Medicare Supplement, then you're still going to have no out-of-pocket. So if you are feeling ill or something like that and you do need to go to the doctor and have the doctor recommend it, that you get tests for it. So that'll be covered by your Medicare. Okay, so if you are feeling anything, don't hesitate to go see your doctor or contact your doctor's office. And then the rest of their message here says, to prevent the spread of this illness or other illnesses, including the flu, wash your hands often with soap and water, cover your mouth and nose when you're coughing or sneezing. Stay home when you're sick. I actually just had a gentleman today call me who was feeling ill the last couple of days. He was supposed to see me tomorrow. He wanted to reschedule for next week, so I appreciate that from him. So stay home if you're sick and see the doctor if you're feeling ill. So that's basically what Medicare has come out to say about the coronavirus. So if you're feeling ill and you want to go get a test done, go see your doctor, contact your doctor's office to get the coronavirus test done. Okay. Now, the next update, and this is one of the topics that I've wanted to cover here in the last couple of months, or actually probably the last couple of weeks. We've been getting a lot of phone calls from our current clients with one particular insurance company, which I will not name at this time, who has had an increase in their monthly premiums for the Medicare Supplement plans. So a lot of our clients have a Plan F with this particular company, and they are bumping up the premiums, a good bit. From 2018 to 2019, they did not have an increase. So our clients only had an age-based increase, which is maybe $7 to $10 on the year. So from 2018 to 2019, this company did not have an increase. But from 2019 to 2020, they're now introducing their increase in March. So one of the things that we want to make sure that if you have a Medicare Supplement plan with us, like a Plan F, is that keep in mind during your birthday month, if you live here in California, we have what's called the birthday rule. And the birthday rule allows us to switch your Medicare Supplement plan from a like to a like. So if you have a Plan F, we can move you to another Plan F with a different insurance company, or we can even downgrade you plans. So we can go F to a G. A G would be a step down from your Plan F, and we can do that during your birthday month. So if you are feeling like your premiums are going up, mark it on your calendar during your birthday month or a little bit before your birthday to give us a call. We'll run through some rates for you. If we want to make any switches, it's a guarantee to do that. So please, on your calendar, write that down, and we'll be glad to help you evaluate whether or not it makes sense to stick where you're at, or if there's some savings to be had with other insurance companies. It really doesn't matter to us where you end up. We want to make sure and service you, provide you that service to switch you to a different plan if it makes sense to. So that's what we want to evaluate for you. Okay, and then the last thing that I wanted to cover today is with the new year, we've had a lot of prescription drug plan switches with our current clients, and so that means a lot of times it means you have to get a new prescription or have your doctor send in a new prescription. Sometimes the mail order companies want to get a new prescription. If it's kind of an older prescription that you've had, they want to renew the prescription. So there's a couple different things that have come up. I had an individual who was put on a new prescription here this month, and he went to go pick it up. Turns out his current prescription plan on Medicare does not cover that prescription, and actually most of the plans on Medicare do not cover it. So there's one thing that you can do is you can have your doctor's office write in. They can either, I think, write in, they can send in a fax request, or usually the insurance companies will have an online, kind of like a portal, where the doctor's office can go online and request that if a prescription was not covered, they can request to have that prescription covered. And this would be called an exception being made by the insurance company to allow that prescription to be covered by your plan. So that's a really important thing. If you find that your prescription is not covered, don't just give up. Have your doctor's office appeal and write in for an exception to be made. And usually the insurance companies have to turn around their decision within 72 hours. So it's usually a pretty quick turnaround time to get that approved. So that's one of the little tricks to it that maybe a lot of people aren't aware of, is that have your doctor's office write in. Another place to look is goodrx.com. We have no affiliation to them. We just find that the coupons sometimes on their website can be in your favor, where you pay less for your prescription by just printing out a coupon on their site than going through insurance. A lot of times it is the pain medications that I see that are the ones that end up being less expensive if you can go through goodrx.com. But sometimes, occasionally, other prescriptions as well. So yeah, if you find yourself in that situation, have your doctor, that's probably the biggest thing. Have your doctor write in to the insurance company to see if an exception can be made. And then the other thing that we've run into, and actually probably 3 or 4 times in the last couple of months, I've had individuals asking me about a particular prescription, and this is an injection called Prolia. And I'm not sure what specifically it's used for. I think it's something with bone density or to help bone health. And with the Prolia injection, there's 2 different ways you can have it administered. One, you can self-administer it, meaning you have it sent to your home, have it delivered to your home by mail order, or I think you can go pick it up at the local pharmacy. So that's one way you can pick it up. If you get it that way, it's going to be billed through your Part D prescription plan. Okay, and with having it billed through your Part D prescription plan can be very expensive, because usually you have a percent coinsurance that you have to pay. It can be like 25% of the cost, and some of these injections can be hundreds, if not thousands of dollars. So imagine just paying 25% of that. That can add up quite a bit. The other way that you can have this prescription administered is in your doctor's office, or you can go to, I think they have special kind of offices where they'll administer a prescription for you, like an injection. If you can get it billed that way, or have it administered that way in a doctor's office, or kind of like a medical facility setting, usually they'll bill it through your Part B of Medicare, B as in boy. If you can get it billed through Part B, And then if you have a Medicare supplement plan like a Plan F, what'll happen is Medicare, your red, white, and blue card, will pick up 80% of that cost. And if you have a Plan F Medicare supplement, that'll pay for the last 20%, meaning you have no out-of-pocket. So if you can get the injections administered in a doctor's office, that's the best route to go, because it's going to reduce your out-of-pocket cost quite a bit. These injections can be, $400 or $500 out of pocket to pay if you have it billed through your prescription plan, when you can actually have zero out of pocket, no copay, if you go to a doctor's office or a service center to get that prescription administered or that injection administered. And same thing apply. Like chemotherapy, for example, same thing. That's administered in a doctor's office usually. So that's billed under Part B of Medicare. And then that, comes back to the importance of those Medicare supplement plans, is you want to have that 20% responsibility completely paid for by your Medicare supplement plan. That last 20%. If you have a Plan F or a Plan G, that'll get paid for. Okay, so that pretty much covers the topics today. So coronavirus, the birthday rule, if you have a Medicare supplement plan, switching those, and then lastly, a little bit about prescriptions. So that pretty much covers it for today's episode of the Medicare Readiness Show. If you have any questions you'd like to ask us in future episodes, we're going to be featuring some of the questions from some of our clients and prospective clients, people who are approaching Medicare as well. And of course, if you ever need help with your Medicare, you can go to our website. It's martinmedicare.com, and you can schedule a Medicare consultation with us by phone, or if you want to come here in the office, if you're local, we'd be more than happy to sit down with you for a Medicare consultation as well. So visit us at martinmedicare.com. Thank you, everybody, for tuning in to this episode of the Medicare Readiness Show, and we will see you next time. Bye-bye.